Hello, this is Dr. Stephen Fishburne, Medical Director of Barnes Care. Today, we're going to spend a few minutes reviewing proper technique for performing the tuberculin skin test, or TST. This is one of the most important procedures for medical assistants and staff to perform. Accuracy is essential for both patient safety and valid results. By the end of this training, you should feel confident performing each step of the tuberculin skin test. You'll be able to describe why we do it, gather the right supplies, and choose the proper injection site. You'll also know how to perform the injection correctly, explain follow-up instructions to the patient, and accurately measure and document the results. Each of these skills helps ensure that our testing is consistent, accurate, and defensible if ever reviewed. The tuberculin skin test, or TST, is used to detect infection with Mycobacterium tuberculosis, the bacteria that causes TB. It's not a vaccine, but a screening tool. We do this by injecting a small amount of purified protein derivative, or PPD, just under the skin. PPD is made from inactive pieces of the TB bacteria. It is not live bacteria and cannot cause infection. It is completely harmless to the patient. We inject a small amount just under the skin, and if the immune system has been exposed to TB in the past, it reacts by producing a small, raised, hardened area. Detecting this response helps us identify infection before it becomes active disease and prevents the spread of TB in the community. When performing the tuberculin skin test, we use a 1 milliliter syringe with a 26 or 27 gauge needle that's about 1/4 to 1/2 inch long. We draw 0.1 milliliters of the tuberculin PPD solution, which equals about 5 tuberculin units. We make sure that the vial is within its expiration date and has been stored in the refrigerator to preserve its potency. The injection site should be the inner forearm, about 4 inches below the elbow. We want to avoid any scars, veins, redness, or hair. Choosing the right site and equipment ensures accurate placement and reliable results. When you're ready to inject, after the skin has been cleaned with alcohol and dried, hold the skin taut and insert the needle bevel up into the top layer of skin at about a 15-degree angle. Inject slowly so a small pale bump called a wheal appears. It should be about 6 to 10 millimeters in diameter. The bump tells you the injection was in the right layer of skin. If you inject too deep and no wheal forms, this test won't be valid, so you'll need to repeat it at a new site about 2 inches away from the previous site. Once finished, do not touch, massage, or bandage the site. This image shows the correct placement for the TST. The needle should stay in the top layer of the skin, just under the surface. When you inject slowly, a small bubble or wheal forms, just like you see in this picture. After the test is placed, remind the patient that they need to come back in 48 to 72 hours to have it read. Reading too early or too late can make the results invalid. Tell the patient not to scratch, rub, or cover the site. And if you need to, you can lightly mark the area with a marker so that it is easy to find at the follow-up visit. When reading the test, we only measure induration, and that's the firm, hard, raised area under the skin. We do not measure the redness. We're going to use a flexible ruler and measure across the forearm, perpendicular to the forearm's length. You're going to record the size in millimeters and not just as a positive or a negative. Whether the results count as positive depends on patient risk factors. This picture shows how we interpret the size of the induration. A reaction of at least 5 millimeters is considered positive for people who are high risk, like those with HIV, those who are immunocompromised, or those with recent contact with an active TB patient. At least 10 millimeters is considered positive for moderate risk groups, such as healthcare workers, recent immigrants, IV drug users, or residents of high-risk congregate settings. A 15 millimeter or more is positive for people with no known risk factors. Remember measuring the firm bump here and not the redness. This is a picture of a positive TB skin test. It's kind of difficult to tell here, but you can see there's redness, and then surrounding that is some induration. These are the most common mistakes that we see. The first is injecting too deeply. If you do not see the will, the test will not be valid. The second is reading the redness instead of the firm bump, which leads to false positive results. Also, timing is important. Remember, readings must be between 48 and 72 hours. And finally, inadequate documentation. So you're going to document the size in millimeters, the site that it was applied to, and the date. Remember, good documentation is just as important as good technique. To summarize, accurate TB testing depends on good technique. Make sure that the injection is intradermal so that the wheal forms. You're going to measure the firm bump and read the result between 48 and 72 hours. Do not bandage the site afterward, and document everything: the dose, the site, the date, and the size of your measurement. Thank you for your attention in reviewing this important topic.